Asacare, Ryancare, Trumpcare, whichever, whatever, the stakes for Arkansas. For charters and vouchers, it could be a session to remember. Workers' comp. Will this be the session business has longed for? And campus carry, a gun bill with a range beyond the campus. Arkansas Week, next.
Arkansas Week is made possible in part by the Arkansas Times, keeping you informed by covering people, events, and politics in Arkansas. By FM 89, KUAR in Little Rock, with in-depth news reporting, analysis, and discussion each weekday.
Hello again, everyone. Thanks for joining us for Arkansas Week. In two capitals, the nation's and Arkansas's, healthcare was the driving story of the week, and that's where we'll begin tonight. Michael Hiblin joins us from KUAR Public Radio in Central Arkansas. Lance Turner from Arkansas Business. Steve Brawner, an independent journalist. Steve, healthcare. Okay, finally we have...
Starting with me?
Yeah.
Okay.
We've got a rollout in Washington that was, to put it mildly, a bit bumpy, and it's worth noting that the gentleman from Arkansas, Senator Cotton, who won office basically criticizing all things Obama, is eager to put the brakes on this thing.
Well, that's right. He's made it pretty clear that he thinks that the House version of it's called the American Health Care Act, which would replace and repeal Obamacare. He said that they're going way too fast. They need to put the brakes on it. Basically, the AHCA would replace the mandates of Obamacare with tax breaks for people to encourage people to buy health insurance. The breaks increase not really so much with income level, but with age, and also the act basically kind of freezes Medicaid expansion where it is and then kind of cuts it out. And so far, Representative Crawford has said no, it's too close to Obamacare. And Senator Cotton has said that they're going way too fast. This version of the bill will never pass the Senate, and they need to go back and slow down. You know, it's noteworthy. This thing was only introduced, basically a few days ago, and already it's gone through two committees. So the House is racing through this. There's a lot of opposition, certainly, of course, from supporters of Obamacare, but also from many Republicans for many different reasons. So it's, both they are against. We got two of our delegation who have made it clear they don't want it, and you've got the other four who have not really said a whole lot about it yet.
Well, they're studying it as of the time we're preparing this broadcast. It's worth noting Mr. Cotton also sits for a state that has accepted expanded Medicaid, which the most conservative House members said that's got to go. They're
right.
at odds with. That's one of the things they're at odds with Mr. Ryan about.
And they're going to be kind of at odds with Governor Hutchinson if it goes far enough. This week, Governor Hutchinson announced that he is seeking waivers from the Trump administration that would allow Arkansas Works, which is the Medicaid expansion, the program that uses federal Medicaid dollars to buy private health insurance. The waivers would allow fewer people to get on it. Instead of 138% of the poverty level, it'd be only at 100%. So you're either only on it if you're really poor. And also the waivers would allow work requirements. So basically the governor is proceeding as if Arkansas Works is still going to be here, even though the only bill that's out there would really call its existence into question here in a few years.
Yeah, and the governor said he realized that uncertainty when he made the announcement on Monday, but said he felt it was best to go ahead and get ahead of this, try to put together some kind of plan. You mentioned the cap, lowering the cap for enrollment to rather 138% as you have right now of the poverty line, lowering that to 100%. That would eliminate coverage for about 60,000 people. And Cindy Gillespie, head of DHS, said that's going to have them sending out letters if this gets approved. You will have to get legislative approval on this, and obviously you have to get the federal waivers approved by the federal government for this to go forward. But they're pretty much taking it, saying that when we get the approval, that was the key thing I noted during Monday's announcement. When we get this approved, that's when letters will go out to those 60,000 people, and they will be transitioned onto the marketplace. And the governor at this point, reacting to the federal news, and this came out the same day, the governor made his announcement the same day that the U.S. House of Representatives announced their plan. The governor so far says he's, it seems like it's going in the right direction, still a lot to be determined, but he had many conversations with federal officials, he said, including a conversation last Saturday with Tom Price, the new Secretary of the Department of Human Services, and said that he feels like what the state is proposing is along the lines of what the administration, the Trump administration, is going.
Well, if it puts them, those 60,000, if it puts them onto the marketplace, there could be a problem there, because how affordable will be the marketplace if the marketplace, in fact, survives?
We don't know what's going to happen. Basically, the governor is...
There's a huge question mark over the whole thing.
The governor's proceeding as if, he's proceeding with the numbers, with what we have now, and we'll have to change it. Part of what was said in that press conference was that there will be a special session in the near future. At that point, it was basically just to enact the results of these waiver requests. But clearly, there's going to be big changes in health care eventually. We don't know what they are or when they're coming. The one thing about this whole situation is that this has made the legislative session this year much more boring than it's been in the past, because the past 3 or 4 sessions, regular and fiscal, have been dominated by the arguments over private option and Arkansas Works, whether or not we were going to keep it and how we were going to fund it and if we were going to fund it. And now, because we don't know what healthcare is going to do, that issue hasn't come up very much, and we're just kind of smooth sailing right through.
Yeah. A couple of other key changes worth noting. This also for the Arkansas Works program would implement a work requirement. The Hutchinson had pushed for a work requirement a year ago or so, and that was turned down by the Obama administration. He believes he will be able to get that. This work requirement would be similar to what you have right now to the Supplemental Nutritional Assistance program. It also calls for creation of a program that would help small employers provide coverage for employees. Also makes Arkansas what they call an assessment state, which would let the state determine eligibility for Medicaid and Arkansas Works applicants. And that's been a big thing that the governor has been pushing for, more control, not having to submit waivers and constantly going back to the federal government for approval for these kind of changes.
Before we move on, back to Mr. Cotton, because I think it's worth noting that in several, what is a vote count worth at this point in the Senate? But I mean, Mr. Cotton seems to be signaling House bill's not acceptable to him. And in several national head count, very early head counts in the Senate, they put him over there as really wavering on this thing.
Yeah.
And I think there's an open question as to what it could do in the House. I mean, it possibly could get through the House, but it would be super close there. But yeah, I mean, I think Tom Cotton has sort of drawn the line in saying, whatever you guys do over there, when it gets here, it's not happening, and you guys need to go back to the drawing board with it. Other organizations, the National Hospitals Association is against this. What's been funny is that there's been almost, sort of criticism on all sides of the aisle for this thing, both in business and in of course the Congress. Conservative legislators and obviously Democrats aren't happy with it, but it's been it's one of those widely panned kind of things that you wonder how it's going to proceed in its current form.
Yeah, AARP too against this, the American Medical Association. So it really does seem like backers of this federal bill, really under fire from all different directions.
That's health. On to education. There were more action this week on the matter of charter schools, specific facilities, also vouchers. We need to catch up on that.
Crazy week with education, really. A bill was passed yesterday that requires schools to sell or lease their unused facilities to charter schools. That was very controversial, but it's basically gotten through. Barely got through too. Another bill got through a House committee meeting that would set up these nonprofits that people could donate money to for a tax credit, and then families could access that in order to go to a private school or homeschool or other kinds of educational situation for their children. Basically, it is a way to get around constitutional and other questions about vouchers. This is a different way of doing it. Also controversial. It got through the House Education Committee yesterday, but it has a ways to go. Then you had about 16 charter organizations or potential schools being talked about that aren't in existence right now, that are looking at opening charter schools. So we're really looking at least a lot of talk about some serious change, additional school choice in Arkansas.
Yeah, and this item about the public school buildings, the school districts, public school districts, being required to let those be purchased for charter schools. It looked like that was dead. We had that come up for a vote in the House, and on Wednesday there weren't enough members for it to be passed. Then and it looked like it wasn't going to come back up. But then Thursday, Representative Mark Lowry said, well, there have been a few developments since then that warrant this being reconsidered.
Primary sponsor.
Right. And he said, and one of them was one group, an educators advocacy group, changing its position. But a lot of people, Democrat John Walker of Little Rock, objected to this being reconsidered, said that wasn't a fair tactic, but it was reconsidered. They then did have debates on the merit, and it then did narrowly get the votes needed to pass. There was some clarification. This would only be buildings that are only used for storage or not in use altogether, that if a school doesn't have as many students as it was designed for, that wouldn't be fair. But you have so many new companies that are proposing creating charter schools in the state, and a lot of people, Vivian Flowers of Pine Bluff, many others, just saying that this isn't fair. The terms wouldn't get perhaps as much money as they should for buying a building or leasing it. Just the terms, and a lot of things have a lot of people saying this isn't fair.
It has been a session that public school has kept public school advocates, the public school establishment, if you will, on edge the entire time.
They've been on edge for a while, actually, because the governing principle around all school policy since the mid-2000s was the Lakeview School District decision, which basically said that the state is in charge of all education in Arkansas. And since that time, schools have always gotten more money, usually around 2%, and sometimes a whole lot more in chunks of money. This time they got 1% more, which is basically less than inflation, supposedly. And I think that there is a growing awareness. Each year, each session is one more session removed from Lakeview. There are now no more Supreme Court justices left who had anything to do with Lakeview. And so I think that there is an opportunity for there to be a rethinking of some long-held assumptions. One bill that's out there by Representative Lowry would require schools to do something with their huge net legal balances. Schools right now have $790 million in savings right now, and he's wanting them to do something with it. There's just there is, I think, there is a reason for traditional school advocates to be a little bit concerned.
And with the proposed constitutional amendment, the legislature, some elements of the legislature see it having an even greater voice in public education post-Lakeview.
Well, I think the legislature is trying. I think you're seeing the legislature assert itself in a lot of areas. Tort reform is one area where the part of the proposal would give the legislature more control over what the Supreme Court, their rules, and there's been an efforts to. I think the legislature is attempting to make sure that it at least is an equal branch of government, if not more.
Lance, workers' comp.
Mm-hmm. Yep.
Always an issue.
Always an issue.
Very frequently an issue.
Right, and one that I think business now sees an opportunity that they can actually, make some progress on. What they would see as progress on capping the length of time that those benefits are paid to a worker who might qualify for those. There's been a bill making its way through the legislature this session that would indeed cap those benefits at something like 8 years and 8 months, or a smaller amount of time than what has traditionally been paid. And that bill seems to be poised. It's already passed the House. Took it a couple tries, but it got through the House, and now it's seemed to be ready to start for debate on the Senate side of things this coming week. And so, business, of course, trying to protect the interests of themselves and how much money they pay. The insurance costs they think could be rising because of what they have to pay for disability and the like. And so the state chamber has been behind this effort this time, as usual. It brings out the usual opponents. AFL-CIO has been fighting it, and other workers representatives who see it as not quite right that those benefits be capped and it's such what they see as a too small of a time to be receiving those. So we're watching that to come up this coming week. A lot of this owes to the removal of a fund last year in 2016 that helped employers pay these benefits. The employers would pay an upfront $200 and some odd thousand, and then this fund would come along and pay the rest of it. Well, that fund has been
exhausted,
done away with,
yeah.
Right? And so now there's no cap. Business says on what employers might have to pay, and they feel they're vulnerable because of that. That you could be paying untold amounts without a cap, and so they're seeking to place that cap now. And so we'll see what happens. It comes up this week, we think.
And a legislature that's tilting right, to put it mildly.
Right. I mean, I think there's probably as good a chance as any that it could happen. Again, you've got your big business in the legislature. On the right, business Republicans seem to be, this is something that they've probably long wanted, and it's now's as good a time as any to try to get it done.
Guns. Next week could be the week because of action in the Senate this week.
Yeah, we had a guns bill. This
hanging from the first day of the session. Right?
In what has actually now come out of the Senate is so different from the original gun bills approved in the House. This was one that would allow, would pretty much require public colleges and universities to allow people with concealed carry permits to bring weapons on campus. In the Senate, and there were a couple of amendments added. One would have required 16 hours of active shooter training. It also would have limited this to people 25 years or older. The NRA and several others didn't like those. Said you already have to go through a lot of training to get a concealed carry permit. This then stalled in committee for a while, and on Thursday, it was extracted from committee and brought up for a vote in the Senate. A couple of changes now. That
in and of itself, pretty rare occurrence.
Yeah. And now we've got 8 hours, up to 8 hours of active shooter training required. The age has been lowered to 21 years old. They've also greatly expanded the number of places, not just colleges and universities now, but bars, state the government buildings, including the Capitol, which is interesting, churches, unless there's an explicit sign saying that weapons are not allowed. for the most part, they would be able to bring these in there. That brought the NRA back in the fold, backing this. But you've had some people, Senator Jimmy Hickey of Texarkana, he spoke against it yesterday and suggested that might hurt him, especially if he runs for re-election, knowing now that he's crossed the NRA. That might make him have to work twice as hard. But it passed the Senate 18-9. Now goes back to the House for approval for these additional changes. And if it is approved, this would go into effect in September.
As amended, let's hit it again. Some facilities, some institutions would be able to post, or would be authorized under the bill as now written, as now amended, would be able to post no weapons allowed.
Yes, that is one thing, yes, but there, certain places they were adamant about they wanted guns to be allowed at the Capitol, which, generally police agencies haven't liked the idea of this at all. Have always said that if there is an active shooter, if lots of people have guns drawn, they don't know who the bad guy is, that it just could make this, rough if indeed you do have some kind of incident.
Higher ed, interestingly, fought this thing for years and years and years, and fought it at the beginning of the session. And at the beginning of the session, it was just staff members on campus. And now, it's basically anyone over 21 who walks on the campus, including students, as long as they have that 8 hours of training. So this kind of illustrates the difficulties.
And the concealed carry permit.
Right, and a permit.
Yeah.
But that was required in the original bill, was the permit. So basically, the end result for higher ed is a much worse bill in their eyes than the one that they fought tooth and nail that probably would have gone through earlier if it hadn't got so much opposition.
On to the economy. BLS numbers this morning, Lance, and it appears, well, A, they're good. Mm-hmm. B, but the era of cheap money may be pretty rapidly drawing to a close.
There's an upside to things and a downside to things, of course. But yeah, there were early indications this week that the jobs report, which came out this morning, was going to be pretty good. There's always a report by a private company called ADP, which conducts their own survey of job growth in the country during the previous month. And they came out with a number that was like 298,000 jobs added. And so that piqued a lot of folks' interest. The number from the government came out this morning, and it was 235,000 jobs added, and our unemployment rate ticked down a bit to 4.7%. So continued strong, the second month of 200,000 plus jobs growth. So all indications are that the economic comeback that we've been slowly observing over the past couple of years is continuing. And then we've also seen wages actually once again start making a bit of a comeback too. And again, decent wage growth was noted in today's report as well. So and wage growth had been sort of the one sort of lagging thing that everyone had wished would pick up even more than the jobs numbers. So some good signs coming out of there. Construction jobs sort of led the way. We've had a really unseasonable couple of months, and so that sort of figured into that. And so, great news for the Trump administration, which I'm sure will be happy to tout those numbers, even though a few months ago they seemed to think that the Bureau was cooking the books on numbers. But
Fed committee meets next week?
Yes, Fed committee meets this coming week, 2-day meeting, and we'll know at the end of that 2-day meeting that what they're going to do on interest rates. I think the chances are a near lock that they're going to raise interest rates because we had an unusually candid statement from Janet Yellen, the Fed chair, in previous days where she all but said, unless we just get an absolutely dismal jobs report, we're probably going to raise rates. So money's going to get a little bit more expensive, but that could be a good thing from a lot of different vantage points, and stocks are up today on the news. So
we've got time to get wine in.
Well, there's always time for wine.
Well,
I think.
The question, though, is what brand and where you buy it.
That is the question. That's been the burning question of this legislature. The grocery store wine bill is what we're talking about, and I think the question now really is will the governor sign? What's the governor going to do? The bill is headed to his desk. This is a bill that would expand the array of wine that a grocery store like a Walmart or a Kroger can sell. Previously, they've been restrained to these sort of small farm batches, leaving the rest of the stuff to the liquor stores. So obviously this bill brought out opposition from liquor stores, and they fought it quite a bit throughout the session, and were unable to get it done. And so Walmart and Kroger under this bill would be able to sell a lot more, which they say would threaten their business. The governor said he's studying it. He was never really, he was kind of neutral on the bill anyway. We don't know yet what he's going to do. We'll have to wait and see.
Two powerful lobbies.
Yeah, I've heard this was one of probably the most heavily lobbied issue of this session. When you do have the big retailers like Walmart and Kroger, and then you have these independent liquor stores saying this is really going to cut into their bottom line.
Because they say that Walmart and the grocery stores can sell food, but we can't.
Right.
And so it's just unfair. So there was a provision that allowed the liquor stores to add edibles that would complement wine. So that was
Pickled
a
eggs,
little bit.
And there was also some a fund set up to help the Arkansas wine industry as well. So there was some carrots thrown into this bill to sort of make it more palatable, but liquor stores still were not against it. And what they see, their biggest fear is that this is sort of another step toward these grocery stores being able to sell liquor of all shapes and sizes, and they really don't want that to happen.
Yeah, got to end it there because we're out of time. Guys, thanks to you for coming in. As always, thanks to you for watching. See you next week.
Arkansas Week is made possible in part by the Arkansas Times, keeping you informed by covering people, events, and politics in Arkansas. By FM 89, KUAR in Little Rock, with in-depth news reporting, analysis, and discussion each weekday.